What should you prioritize when choosing a Medicare Advantage plan? We have helped thousands of people with their Medicare over the years, which means we have signed a lot of people up for Medicare Advantage plans. In this video, we're going to talk about our process with our clients and what we tell them they should focus on when taking a Medicare Advantage plan. Let's dive into it. The first thing we start with is a conversation about doctors and hospitals. The thing we start every single Medicare Advantage conversation with is your doctors and the hospitals in your area. One of the keys to your healthcare being successful is having the doctors you want to see available and having access to the hospitals in your area. This is not always possible because if you have multiple doctors, you may not be able to see all of them covered under one single plan. But this is always the starting point because having your consistent doctors involved in the plan is important. Secondly, we focus on the out-of-pocket costs. We find that the biggest potential costs in an Advantage plan are at hospitals, outpatient facilities, and for treatments for things like chemotherapy and radiation. You want to reduce your exposure to this as much as possible. So in summary, the first thing we start with is doctors and hospitals. The next thing we focus on when we talk about Medicare Advantage plans is prescriptions. Prescriptions on Medicare have a highly variable cost structure, and it can be confusing if you're not educated on the topic. But as a general rule of thumb, if you are on generic medications, by and large your costs will be low. If you're on brand name medications, by and large your costs will be high. You'll also want to make sure the plan covers your drugs. Some plans don't cover certain medications. Making your prescriptions as affordable as possible is paramount to maximizing your Medicare experience, and every plan out there covers prescriptions differently. To summarize, we will start with your doctors and hospitals and then add prescriptions into the mix. Best case scenario, all your doctors and all your medication is covered. If not, we start to compare which plan covers the most doctors and has the best overall cost for your prescriptions. For better or for worse, you may have to make a few compromises to get what is best for you given the options available in your area. The next thing we talk about is dental and vision. Only after we've talked about doctors and hospitals and prescriptions can we talk about dental and vision. A lot of our clients will want this to be their main focus, and for some, it's for good reason. Dental surgeries can be very expensive. And if you suddenly need a ton of major dental work done, you obviously want it to be your focus. But even though dental work can be expensive, hospital and medical bills can be much higher. Hospital and medical bills have a much higher ceiling in terms of costs, and we want to alleviate that before we talk about expenses like dental that have a lower total cost ceiling. The other factor is many dental benefits within Medicare Advantage plans max out their contributions at $1,000 or $2,000 total for the year. This means that even if you have coverage for dental procedures, you may still be stuck with a large out-of-pocket cost for dental. So again, we focus on hospital and medical costs, then prescription costs, and then dental costs, because dental, as we talked about, can have very large out-of-pocket costs regardless of the plan. The last thing we dive into with our clients is extra perks like gym memberships, over-the-counter cards, flex benefits, and more. Many times our clients come into our meetings wanting to talk about these extra perks. Their neighbor has gotten a gym membership, their cousin has $400 a year towards over-the-counter benefits, the list goes on. So we have to slow everything down and explain the other 3 points we just talked about. Remember, these are health insurance plans, which means you should focus on health insurance before anything else. A free gym membership is great, but not being able to access your doctors is not worth it. $70 a quarter towards vitamins is cool, but paying way more for your prescriptions is not worth it. We always recommend on focusing on the healthcare portion of your Medicare plans before looking at extra perks. Focus on your doctors and hospitals. Focus on your prescriptions. Focus on dental and vision. Then focus on the nice perks. These perks should be a cherry on top, not the main focus. Now, if you're healthy and just want some free stuff, maybe you could focus on these extra benefits first, but I still wouldn't recommend it. You never know when something will happen with your health, so it makes sense to plan for the worst even when you're doing okay. Blindly taking a plan because of an extra benefit only to be later hit by a massive bill is never worth it. Now, to summarize, you want to focus on your doctors and hospitals, then your prescriptions, then dental and vision, then extra perks. And all of this is based on our experience, so keep in mind everyone's situation is different and everyone should be treated uniquely. But it should be clear that doctors, hospitals, and medical expenses are the first priority in any plan, and then the focus should shift to any ancillary benefits. Now, if you need help with your Medicare Advantage plans and choosing what's best for you, feel free to reach out to us at www.njlifeandhealth.com or call our Toms River, New Jersey office at 848-226-6897. And don't let the NJ in NJ Life and Health fool you. We are able to help people in over 20 states that we're licensed in, so feel free to reach out to us. We probably can help you. And if you're someone who just likes to learn at your own pace, we have a ton of great educational content on our channel. So check out the videos, like, subscribe, share, and comment below if there's a video that you want us to cover. Thanks again.